announced. So recording is in progress. I announced like, yes, 130 people from, including the GFAN members that are probably already listening now. Yeah, yes, I see the meeting room. So the meeting will start now. The meeting is recorded. Before we start, I would want to ask all participants who are not on the panel, not speakers, to switch off their microphone and to switch off the video, their videos, so that only the speakers are there on screen if possible. So hand over to Holger, please.
Thank you, Peter. Good morning. Hello and good morning, everyone. I'm very happy to welcome so many participants to such an important discussion this morning. I think some are still arriving. Peter announced 130 people, 80 from GFAN meeting and 50 who have registered in addition. That's a great number for an important topic this morning. We will talk about the importance of basic health services in difficult situations for people most at risk, including people living with HIV and tuberculosis. Difficult situations such as the war in Ukraine is the most urgent, but not the only crisis we have to face. My name is Holger Wicht, as Peter already mentioned, and I'm the spokesperson for Deutsche AIDS-Hilfe. I welcome you all very warmly on behalf of the organizers of this discussion this morning, Deutsche AIDS-Hilfe, which means actually German HIV and AIDS Service Organization, but it's untranslatable. AIDS Action Europe and Action Against AIDS, sorry. That was from a perspective of harm reduction, a bad way to pronounce this. Yeah, so much action in the titles of the organizations. I guess that's a good sign for a lively discussion this morning. I would also like to extend very warm greetings from our executive director, Silke Klump, who would have loved to be here this morning, but is unfortunately unable to attend. We all know how urgent our topic is this morning. The situation in Ukraine is a disaster and has also severely affected the fight against HIV, tuberculosis, and malaria. Even though the country had made immense progress before and is showing remarkable resilience under the conditions of war. We all also know the importance of the background to this discussion, the Global Fund Replenishment Conference this year in the United States. Its goal is to mobilize enough money for an effective response to the epidemics the fund has in its name, HIV/AIDS, tuberculosis, malaria. And yeah, well, this has always been the case. And the outcomes of these replenishment conferences have always been critical to what successes became possible or not. To make this very clear, this decision is about how many lives can be saved, how many people are able to access healthcare and prevention. That has always been urgent. But this year, the situation is particularly dramatic. COVID has left severe damage globally, and the war in Ukraine poses a dramatic threat to life and health for so many people. In addition, that's why we are talking here today, and why there's a series of events on the topic this week. We are very pleased that the Global Fund Advocates Network is coming together in Berlin to bring attention to its important cause. We very much welcome 80 participants from the global HIV, TB and malaria community to Germany and Berlin. You are very welcome, guys. Have a good time here with us. The Global Fund has provided 850 million euros since 2003 to address HIV, tuberculosis and malaria in the Ukraine, to support key populations and enable harm reduction. After the war began, an additional $15 million in emergency funding was quickly mobilized. Now we are faced with an unprecedented situation. That's why all this money was necessary. Nearly 7 million people have left Ukraine as refugees. 3.6 million have left for Poland. More than 700,000 refugees from Ukraine have been registered in Germany so far. But there are also 2.2 million people in total who have already returned to Ukraine. The country faces the challenge of maintaining medical care despite the war. There are about 250,000 people living with HIV in Ukraine, and more than 17,000 are receiving substitution therapy. We all know about the damage and risks through interruptions in therapy. But of course, medical facilities and care structures have also been destroyed or compromised by the war. Therefore, maintaining therapy is a major challenge in Ukraine itself, but also in the countries where refugees arrive and live. Deutsche AIDS-Hilfe is ready to contribute as much as possible to solving these problems. And doing so together with many partners already, we have once again seen how strong our community is and how much we can achieve together. This is a really encouraging experience of the last weeks and months in these difficult times. And with that in mind, let me say, it's really great that we are all here together this morning. So let me briefly introduce the panelists of today's discussion. There is Andriy Klepikov. He's Executive Director of Alliance for Public Health, Alternate Developing Country NGO Delegation of the Global Fund, Ukraine. Hello, Andriy. There is Valeria Rachinska, 100% live from the Ukraine. Nice to meet you on a panel again. I think it's the third time already. Always been great. Hi. And Francesco Moschetta, he's Senior Advisor Challenging Operating Environments from the Global Fund. Hello, Francesco, welcome. Yes, and let me also introduce and hand over this discussion to the moderators of this morning, Oksana Panochenko from Deutsche AIDS-Hilfe and AIDS Action Europe, and Peter Wiesner, Action Against AIDS Germany. Over to you, Oksana and Peter. Thank you.
Thank you very much, Holger. Thank you to everyone. Welcome here. We are very happy to see you and to kick off this discussion. My name is Oksana Panochenko. I'm originally from Ukraine, but I'm now living in Germany already for a few years, and I work for AIDS Action Europe as a project manager. And Peter, word to you.
Yeah, my name is Peter Wiesner. I work here for Action Against AIDS Germany. I'm a community activist, I would say, and of course, member. Our organization is member of the Global Fund Advocates Network. So hello to everyone. Over to you, Oksana, please.
We would like to talk a little bit about housekeeping rules, which Peter already named a little bit. I will start and Peter add what I didn't say. So as we asked before, please turn off your camera and microphones because we want to have the speakers on the video so they will be seen. Session will be recorded, as was already mentioned, and will be made public. And there is also a chat function. If you have any questions, please feel free to write to the chat. The discussion will be strictly 1 hour. We will try to be all to the point and as short as possible, but also as clear as possible. And the big part, what we want is to have no presentations, but rather have a lovely discussion. Is there anything from your side?
Everything said. Wonderful.
Perfect. Then I would like to go directly to the speakers since we have quite a small amount of time. Hello again. I would like quickly to ask you just a short answer to this question. Who are you? Where are you at the moment? And what organization do you represent? Andriy, word to you.
Hello, good morning. I am Andriy Klepikov, Executive Director of Alliance for Public Health, NGO working in Ukraine and in other countries of the region, and alternate board member of the Global Fund representing developing country NGO constituency. I'm currently in Lviv, in Western Ukraine, in our office here. Now we have office not only in Kiev, but in Lviv.
Thank you, Andriy. Valeria, same question to you. Who are you? I mean, I know who you are. I met you many times, but for everyone, who are you? Where are you now? And what is your organization?
Okay, I'm Valeria Rachinska. I'm working for 100% Life. It's the biggest Ukrainian patient organization. And currently, I'm director on Human Rights, Gender, and Communities Development Department. Right now, I'm in Napoli, Italy, like taking care about my son. But tomorrow, I will be in Ukraine already because we are starting a new project to help people in need, our communities. Also, I'm community activist and I'm a woman living with HIV, openly with my status, like about 6 years already. Over.
Thank you, Valeria. And Francesco, similar question to you, maybe a little bit different format, but please tell a little bit about you and your background. And also where you are, if you feel comfortable to share with us.
No, actually, the Global Fund is actually based in Geneva, not very exciting about the, I've been working with the Global Fund for over 10 years, so I'm kind of old at the organization. And before joining the Global Fund, I used to work in humanitarian settings with the UN and other international organizations, so I'm quite familiar with the crisis and responses to emergencies. Thank you.
Thank you very much. And now we would like to go to the discussion more deeply, and that would be first to Valeria and Andriy. Could you talk a little bit both on, because you already mentioned what you do, but more what you do professionally and how it has been changed due to war. And I will ask first Valeria, if you could respond to this.
Yeah, so my topic, it's human rights and community development. And before the war, we did implemented like a very, very big amount of activities from Global Fund, funded from Global Fund and other donors as well, about changing laws and policies, community-led policy changing. Also, we did capacity development, and we developed like our communities in each regions of Ukraine, like it's 24 regions. Each community have a representation in each region of Ukraine. But your question is a bit tricky because war for us started in 2014, not in 2022. And before this, we had like a different kind of lives and different projects, and yes, and like a totally different targets. But since 2014, the main our activity is saving lives of people actually that live in this conflict zone, non-government controlled areas, and access to treatment for all these people as well, because it's like a basic rights of people living with HIV to have their treatment. So we were serving all the people living with HIV on Donetsk and Luhansk occupied territories, serving with medications, providing with services, and providing actually with human rights as well. So, and but in 2022, the situation changed dramatically because full invasion started, and all these projects were under the street of interruption. All the treatment programs on human rights, of course, and even like lives of our beneficiaries, of our communities. But thanks God, we have a very flexible donor, because Global Fund is our main donor, and the organization showed us such a flexibility, understanding, really humanitarian response and decency. So that no one of our programs weren't interrupted for even for 1 second. We saved human rights programs. We saved our services. We saved our patients, and we made reprogramming of these activities for the most important, to save lives of our people. So organized evacuation, organized shelter, organized like emergency, like a support of our patients, and to save access to treatment. So can you imagine all these activities were designed in 2 weeks? No one organization, no one humanitarian organization in the world didn't react so quickly and so professionally. So right now, situation is challenging, but all the programs works well and 100% funded.
And one very brief question to you, because I was sort of shocked and impressed because we are sort of Facebook friends, and I've seen you sleeping some nights with your kids in the subway when the war started. Can you just tell us, so you did choose to stay in the capital and are still there. Just be very briefly, and then we go over to Andrei.
Of course, we were prepared to this war because we knew that war is coming, that it's not if, it's when. But okay, all of us, we had our programs, project, our communities, so we couldn't leave in 1 second. But the 24th of February, all my family, we woke up from bombing that was actually 5 kilometers from my place. And you know, my brain reacted like strangely because I used to these noises. I spent 2 years in 2014 and 16 delivering medications to occupied territories for people living with HIV. So I just turned on another side. Okay, it's from us, it's not to us, so it's safe. And the next was no, it's war started. So I woke up my kids, I evacuated my kids to bomb shelter. We spent there for a few days, but you know, how can you help people if you're yourself in vulnerable position? So I took hard decision to evacuate my family firstly to the western part of Ukraine, where we spent like working and supporting everyone like during about 2 months, and then I evacuated my son to Italy, to more safer place, because no one kid shouldn't face the war in any places. Yeah.
Thanks so much, Valeria, for sharing this. It's just so impressive. Oksana, are you going to?
Thank you, Valeria. Also, thank you for noticing my tricky question, because again, as Ukrainian myself, I also very much noticed in February 2020, people were asking like, are you shocked? What is happening? And I was like, we are not shocked. We've been expecting this. We have war since 2014. 2014, I feel, was shock for everyone in Ukraine. This one was just something that we were mentally prepared that it's going to happen at some point. So thank you very much for bringing this again up, because I feel like we need to continue talking about this. And then I'm going to go to Andrei, unless Valeria wants to say something. Then I'm just jumping directly to Andrei to respect the time. And similar question, Andrei, like what do you do professionally and how the war has changed this?
Yes, war changed a lot in Ukraine. Just look at the numbers which were voiced already, that 7 million people became war refugees, moved abroad, and 8 million people moved within Ukraine, became IDPs, internally displaced people. So I would not underestimate all the damage and risks, including to HIV and TB program, with actually some patients being killed, with some being lost, and with services being interrupted. All services, including treatment. So Valeria is too optimistic, I think, in assessing the situation. At the same time, in terms of our response, what was good before the war, we developed a risk management plan with different scenarios, with cyber attacks, with some small like terrorist attack, with escalation on the east. And the final scenario was full-scale war with involvement of aviation and artillery. And at that time, to be honest, it was rather theoretical scenario. So we were much more expecting escalation on the east or some small intervention. But that was great that we went through these exercises and we went through these scenarios both for our organization and for our NGO partners, civil society partner. We have over 100 implementing partners all over Ukraine, in all regions. So it really helped us to prepare organization even on the eve of the invasion. We transferred funds to NGOs, so they had sufficient supplies of cash, they had sufficient supplies of commodities. We moved some commodities into safer locations. So it was a very essential preparatory work. And of course, as Valeria, I also woke up at 4 a.m. with my family from explosions when Russia started to bomb all major cities all over Ukraine. And of course, during the first stage evacuation, there was a focus on evacuation. We also had mini vans. We helped to evacuate people from Bucha and Irpin. And could you imagine that every evacuated person from such hell Russian army did in Bucha saved lives. And for programs, we modified these programs addressing needs of displaced people. So when your patients and clients are mobile, you cannot be static. You should be mobile as well. So the services of the mobile units we have were at the highest demand because they could reach people in different locations, including remote one, and the demand in services actually increased. Some clients were new, which got registered but didn't attend often services. Because maybe they had a pharmacy on the next corner that could easily buy syringe. But in the context of being IDP, with no money left, with no shelter or apartment to stay, all these needs increased. So my message is that people who were vulnerable in the normal life became much more vulnerable in the context of war. So we also try to address humanitarian needs, get access to humanitarian support, and provided this basic support, housing, referral. Sometimes it's even legal support for to get registered as IDP, and also accessing services. I am in Lviv, for example, and it's amazing that to take patients on opioid substitution therapy usually it takes a while. But in this case of war, all processes were streamlined, catalyzed, and it was a possibility for a patient to come by early morning train to Lviv with nothing, but with a prescription, and this person was taken on the treatment at the same day. So there are a lot of inspiring examples how civil society and community are responding with peer support as well.
Thanks for this, Andrei. My question to both of you, and then we would go over to Francesco, is, you know, to what extent or how important was the help of the Global Fund in that context? So just talk for 2 minutes about the role of the Global Fund here, and then we hand it over to Francesco. Andrei, please.
Yeah, actually, Global Fund responded better than any other donor. First of all, with allowing flexibilities, with the country team being accessible and responding in 24 hours, and also with a quick decision making. What helped also that we were able to reprogram, reallocate resources we already have in the country into the emergent needs. So it's not a new money we should wait for weeks to come, but immediately. So that was a great help and great flexibility of the Global Fund, with the fastest and more rapid response than any other donors.
Thanks, Andrei. Valeria, do you have anything to add here? That question.
I have to add a lot, to be honest, because Global Fund, as I told before, it's for us started to be not a donor, but partner that provided not just help with redesign and grant flexibilities and with full understanding, but, you know, like I would say even like some kind of mental support. because it was a reliable partners that we could rely on during like such a situations that, you know, like a lot of agencies, they didn't react so quickly and so professionally. And I think that and other agencies can have a lot of lessons learned from the reaction of Global Fund, and keep them as the best example and the best practices of like implementation HIV response in emergency situation. So big respect to all the team, and especially as related more to human rights team, because they were like amazingly quick, amazingly professional, and amazingly supportive. So I can say that this response saved like 100,000 lives.
Okay.
Without consideration.
So thanks so much, Valeria. So to the audience, we did not pay you to be nice to the Global Fund, but what I heard here is, yeah, a donor that became a partner and a flexible approach. I mean, this is just a compliment, and yeah, very nice. Thanks so much. And now over to you, Francesco. When you heard about the war the first time, what was your first reaction to it? What did you do in order to secure the programs people are living on, harm reduction programs, HIV, tuberculosis medication, and of course, what did you do to secure the life of those who are working on the ground? Because this is probably the main or one of the main concerns that you would have. So over to you, Francesco, and explain us a little bit the word of so that the Global Fund uses funny words, and I have to sort of read it, not to misspell it. So it's challenging operational environments. So what is this all about? What did you do?
Okay, thank you very much, Peter. And thank you very much for the comments that are coming from Valerie and Andrea, and highly appreciated, because that means that what we're doing works. But just to, I think, confirm also that the Global Fund is you. We couldn't do it without Valerie and Andrea and the whole organization based in the country. And that is the first probably comment that I would like to make. It was a great engagement with you for the first day. Maybe just to step back a little bit, as you said, I mean, the situation was very volatile even before the invasion. So we've been monitoring internally the situations and the evolving risk and all the possible consequences. So we call it a little bit contingency planning with different stakeholders. So to some extent, we were closely monitoring, early engaging with the different stakeholders to understand how the situation could evolve and be ready also to step up. But that has been also built on experiences from other portfolios in the past, where the early engagement, some preparedness has been also helping. The Global Fund is a development institution, but with a strong responsibility and accountability around the people living with HIV, people living with TB. We cannot leave no one behind, including those settings. So that is our strong responsibility, and therefore we've been developing an approach to be able to respond quickly. And I'm very appreciative of the fact that you've been using a lot of flexibility, because that is really the key word. From the day one, the country team have been closely, regularly. I think they couldn't actually sleep. I've been in regular contact with you in the country, with different stakeholders also, including humanitarian partners that have been also ready to step up. For the Global Fund, it's always important also to be able to coordinate with the existing humanitarian platform like the cluster, health cluster, logistic cluster, to understand the dynamics of the country, being able also to secure that we are able to address those situations within the conditions. We are based in Geneva. We really rely a lot on partners based in the country or close to the country. As Andrew said, and Valerie, the first response is we do have an envelope, or we do have a funding country. It's much quicker to authorize the use of a funding in a different way to address emerging needs. different situations. So that was the first response from the country team. Absolutely openness to understand what were the needs are coming from the country, being able to approve them very quickly. The speed is important in those situations. Global Fund is a slow structure because we work in development, but for those situations, we really care about speed, and we have to be quickly responding to the situation. So we've been focusing on needs coming from the country, requests are coming from the civil society, from the PRs, so being able to respond and adapt the grants with a lot of flexibility. We have approved the reprogramming over 50 million in reprogramming activities, meaning activities that were reallocated to different budget lines based on the needs, including psychological support. I think also Andrew was actually talking about internal displacement. Of course, the population was moving, so we had to support also this adaptive approach. We had to be supporting a mobile interventions rather than stable, because things were evolving. But again, thanks for the information coming from the country. That was the very close and strong communication. And then the other element that we've been mobilizing, of course, is the extra funding, the emergency funding, which is an extra envelope to support, especially to make sure that there are no gaps in commodities. In those situations of the crisis, we have to make sure that we also been able to step up and step in to fill gaps on commodities, so tests when it comes to TB, HIV, but also on IST treatments. And that's been also prepared to some extent with other partners like a PEPFAR for HIV treatment, other donors, just to make sure that we are complementing each other.
Thanks so much, Francesco. We are going to talk about other challenging environments in a minute, but now for the time being, we would sort of go back to Andrei and to Valeria. So Valeria, let's start with you. I think you talked about communities that are in particular vulnerable. So could you sort of discuss this a little bit further? So what communities are we talking about in terms of tuberculosis, in terms of drug consumers, in terms of, and I didn't hear anything about the situation of prisoners, for example, in the Ukraine. So what happens to those incarcerated that are placed in places that are all of a sudden in a war situation or occupied? So just talk about the communities you feel comfortable talking about, and be brief, and then we hand over to Andrei. Thanks.
Thank you. So I'm comfortable to talk about any communities because we everyone in the country. So yes, we have a funding for communities of men who have sex with men, for communities prisoners and ex-prisoners, for people living, for people with tuberculosis, for adolescents living with HIV, women living with HIV, people living with HIV, sex workers, people who use drugs, people on opioid substitution therapy. And like we transgender people, so, and we support all of them. And you know, I think that it was the best investment of Global Fund during all these years to invest in the communities. Why? Because of this community development grants that we gave to the people, we started to have regional representatives of each of the communities in each region of Ukraine. So that was a reason why we could provide immediate response, because we had a strong connection on the field, and our regional representatives of communities was reporting immediately about any problem, so we could like react immediately as well and cover all the needs in emergency situations. So for the years 2021, 22, 23, Global Fund planned to invest in the communities about $9 million, and I think this is like a very good investment, very nice wise investment, I would say, because it's already returning back all the saved lives, because the communities, they're always on the front line and they always providing the best help based on the needs, on the real needs, not that big donor like invented somewhere, but on the basic needs like in the reality. So they provide, yes.
And there's a war situation now. So my question would be, because there is a war, are there certain groups that are really even more vulnerable than the general population? So talk about that, because, I mean, we know that we all deal with key populations and all of that, but we have a war situation now. And the question is, is a transgender, for example, safer in a war situation, or is there anything that you have to deal with on the ground? Thank you.
So, thank you. So all our communities started to be more vulnerable because, of course, transgender people, they need their hormonal therapy, and it was lack of medication, lack of money for this therapy. It's not provided by government for free, so people need to buy, and the economical situation started to be really bad. So if we are talking about, for example, and they couldn't leave the country because of material law, that all the men from 18 to 60 just cannot leave the country. Because they're eligible for military services. If you're talking about people living with HIV, of course, it's always access to treatment. And, in March, the situation of with treatment in Ukraine was really horrible. And only because of collaboration of all the partners and PEPFAR that bought these medications and 100% life that delivered this medication, we could avoid interruption of treatment for the whole country. So if you are talking about people who inject drugs, or for example, people on opioid substitution therapy, their vulnerability because we need it every day, and people can come back to street drugs, or like in Crimea in 2014-15, when Russian Federation stopped all the OST, it was about 80 cases of suicides because of interruption of treatment. So if you're talking about OST clients, so we had the situation when evacuated from the war zone, like a frontline people, weren't accepted by local communities, were threatened to be killed because in their mind, people who inject drugs, they don't need to live. So stigma, discrimination, lack of treatment, interruption of treatment, and material law, and of course, usually our communities economically the most vulnerable because stigma, discrimination, reputational risks from the past. Sometimes people getting sick too much, and employers don't want them. So everything you can duplicate on 10 all the problem when it was started. So that's why the help for these people was such crucially important.
Thank you very much, Valeria. And same question to Andriy, but also could you also talk about what is happening on the occupied and especially deoccupied territories? There are a bit already mentioned, but I think that would be also interesting to learn for us.
And to the participants, if you have questions, there's a chat function, so you can raise questions and we will pick them up if they are appropriate, of course.
Thank you, Oksana and Peter. Yes, in terms of the most vulnerable groups, I also would like to highlight patients on opioid substitution therapy, because as we learn from Crimea, Valeria mentioned this, that that's a program which was brutally cut off, and medicines in Crimea following annexation in 2014 were just burned. All medicines were burned, by Russian army, like books were burned in Middle Ages. So it was a terrible cutoff, which led to deaths of many patients. Over 80 died from not only suicide, but also health complications. Some from overdose, switching back to using legal drugs, some from other complexities. So that's why that was a key message for the patients to move, and we helped to move some of the patients from the territories at the risk of occupation or already occupied when it was a possibility to move. Even for some prisoners which were on opioid substitution therapy treatment in Zaporizhzhia Oblast, we managed to move them to another location with our support. So it was amazing examples how patients were saved, actually. My organization, Alliance for Public Health, issued regular reports, and the situation reports, thematic, one is dedicated on opioid substitution therapy, with exact map all over Ukraine showing the especially risky areas. So over 50 sites of opioid substitution therapy stopped the operation, unfortunately, due to the active locating at the active war areas, or because of the destruction. But some patients moved, and it's important. That's the example I gave earlier in Lviv, where people getting back on treatment. And actually, number of patients and need is much higher, because in addition to the, say, official governmental program, there were also private clinics which were cut off from the services. One example I could give also procurement of OST medicines, methadone in particular, because medical factory in Kharkiv was bombarded and destroyed. So we did emergency procurement from Odessa factory, and not only to procure it, but actually deliver it. As you know, it's very complicated process before the war, with security guards, with all these permissions. Now, as I said, one of the advantages that with approval and by the Minister of Health, we did it with our vans, did also delivery, including in the locations. Initial logistic providers declined to go because of the risk of the drivers. So this is an example how NGO stepped in and saved actually national program, national-wide program with their willingness, readiness, and capacity to help.
Thank you. So we both thank you.
Yes, and I just had one more question, which I think maybe I missed it, but could you talk a bit more about tuberculosis services? What is happening with people with TB? Because I think that was not particularly mentioned.
And we have only 20 minutes to go, so be brief. And there's one question about children in the region, and we want to keep this really brief, because we would like to get over to Francesco. There are more things we want to discuss, and time is always too short. That's why we have 1 hour, because everybody is sort of excited and that, oh, it's so sad that it's over. So yeah, Andrei.
On TB, situation is still quite concerning, because we don't have contacts with all the patients. So some of them we are still reconnecting. The key thing is that tools we applied during the COVID-19 pandemic became very relevant in the time of the war. With video not directly observed treatment by WhatsApp or Viber or Telegram, other tools, and also with psychosocial support to patient. It was a critical link between those patients' IDPs, because sometimes they call firstly their social worker and their case manager firstly, then the doctor or nurse, because of the established trust and connection. This is an example, unfortunately, where also a lot of facilities were damaged in places like Mariupol. We have a terrible video showing that office of the Red Cross there were turned to dust, nothing left there. From other locations, also in occupied territories like Kherson, the oblast bordering Crimea, there are still key medicines are available, but the supply is shortening with each day. So this is another issue, how involve humanitarian organization to do delivery. And some patients were killed, brutally killed, like everybody heard about Bucha, Kiev suburb, where Russian army did a lot of war crimes. 2 TB patients were murdered and killed there. They were well treated, well on treatment, on TB treatment, but they were killed and died from the Russian invasion.
So thanks so much.
Again, this is horrible. And Valeria, if you have anything to add to this.
Yeah,
about TB services.
I agree with everything Andrei said, but just a big thank you again to Public Health Center that supported all the patients and did like sometimes impossible things to retain people on treatment during this hard time. For example, when the hospital in Chernigov was bombed, they evacuated, like literally under bombing, all the patients to another hospital and saved people on treatment and treated them well and so on. So all the stakeholders were consolidated around all these troubles to solve it. So that's why good expectations on continuation all the programs. But
okay. Thanks so much to both of you. We will, I mean, we hear these terrible stories and we hear it every day. Just switch on your TV and you hear stories about Ukraine. This is horrible, absolutely horrible. We know that. Francesco, you hear these stories every day, and challenging environments, operational environments are not only taking place in the Ukraine, there are more of these environments. And there was this question from our colleague Fiona about children in warlike or in such challenging environments. And I think you probably are best equipped to sort of address this issue of vulnerable populations, vulnerable children. So what are the other challenging environments that you are experiencing? So let's broaden up the discussion a little bit, because of course there's not only Ukraine, right?
No, but it's always extremely touching to hear direct witnesses from our colleagues Andrei and Valeria, and I really appreciate what they're doing, because that is incredible. But it's true. The Global Fund has been able to adapt himself and the programs to work in settings like northern part of Ethiopia, Tigray, Mali, in the northern part of Mali, Central African Republic, South Sudan. Always environments that are very fragile by definition, because there are security risk, there are issues about accessibility, there are issues about availability of the data, structure, facilities. So we, since 2016, when we approved what is called the challenging operating environment, which is a very unique definition of the Global Fund, but reflects a little bit those environments that are quite challenging for implementing Global Fund mandate and being able also to reach the population. And for those environments, we have learned through the approval of the policy, but also in the course of the year. So the policy had been approved in 2016. In the course of the year, how to adapt ourselves in those settings to be able to deliver services. That includes also children, but includes also key population in very fragile settings. Because as you rightly said, I mean, the key populations are at risk, but in those settings even more. So we need to be able also to adapt ourselves. Andrei and Valeria were talking about flexibilities, but also the way we've been engaging with the humanitarian partners, civil society, different actors in a very simplified contracting arrangement to simplify also the way we work in those settings, because the Global Fund tends to be very heavy at times in terms of the process and requirements. But in those settings, I think Andrei mentioned, we streamline procedures, we streamline discussions, we focus on essential services, we focus on commodities, we focus on key population, we focus on who is able to deliver those services. The number of the situations we've been reaching out, also working in refugee settings, IDP settings, And probably you know now by the situations also around Ukraine, UNHCR usually is coordinating the efforts towards refugee populations. So we've been collaborating a lot with UNHCR to make sure that HIV, TB, and OST services within the refugee settings are taken care. We've been collaborating to them to make sure that commodities are provided, tests are provided. And when it comes to IDPs, it depends on the environment. So usually also the international community develop or establish the cluster approach. We are member of the cluster, sort of a global level. At the country level, we make sure that the country coordination mechanism and the cluster, or our implementers and the cluster, do work together to make sure that we are addressing the right population. So we've been, over the past year, so we've really been evolving the way we are engaging in those settings to make sure that population that we serve, the mandate of the Global Fund, is delivered in those settings, which is not easy. It's not, we don't have because we count on you. It depends very much on the people in the field. It depends on the much on partners in the field. We rely a lot on different partners in those settings to deliver our mandate.
Thanks so much, Francesco. We have 10 minutes to go, and there are 5 minutes at the end for Lady Ross. So altogether there are 5 minutes, and I would ask Valeria and you, Andre, what kind of support do you need at the moment from the Global Fund? Is there anything additional that was not addressed? Is there anything you wish? So since Andre, you're nodding your head, you're the first, and then Valeria can consider what to say. Andre, please.
Thank you, Peter. Yes, more support is needed. One is because of the terrible things we see on the occupied territories of Kyiv Oblast, Chernigiv, Sumy, and we will see more. When clinics are destroyed, we need to build new system with the mobile units, mobile clinics. This is a great demand in this, and we really hope that Global Fund will proceed quickly with supporting this. Because as I said, when your clients are mobile and when clinics are destroyed, we need to be mobile too. Second, we still have to renew contacts with many patients. So for this, we need to offer address emerging needs. I can give you an example with overdose prevention. Demand in naloxone increased 3 times. We are addressing this, but this is the message that for some services, demand may increase in 3-4 times, which also requires 3-4 time increase in scope of resources. And finally, there is a patient's needs. They are quite unique. It's important to move from standardized service package to more tailored, because in the context of war, you have to be responsive. You have to address needs which are not initially budgeted, which were not initially planned, but it's impossible to say no. So that's why resources for this is also essential.
Thank you, Andrei. Peter, you're muted. I'm going to jump in. Valeria, same question for you for a minute. Yes. If you can quickly say what.
I support everything Andrei told, like 100%. And I want to add that we need more funding for evacuation and for shelters, because people migrating and people like coming back home, returning, then changing place of living again. A lot of people like literally without any place to stay. So shelters, evacuation, then special focus on survivors of sexual violence related with war. Because it's a lot of people that don't want to even talk about it, but we know that they're suffering it. So, and you know, maybe would be good idea for Global Fund to jump in global discussion about supporting of occupied territories, because as I know, no one organization has right now mandate to operate on newly occupied territories and on all occupied territories as well. And this is for us a big problem, because it's about delivery of medication, it's about providing services, it's about providing like a financial support and food security support to our clients. And that's why with all the experience of Global Fund, maybe they can be very helpful on the global level, negotiating with all the humanitarian agencies to share their experience and just help these missions to be in and help our people on occupied territories.
Thank you very much, Valeria. And I have a quick question to Francesco, also final question. I imagine myself whenever the emergency fund is initiated, the Global Fund, it turns into this very, 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 very busy beehive. Could you tell whether there is any new lessons learned from the recent developments, specifically from the Ukraine, the Global Fund will use in the future?
And Francesco, you have only 1 minute. I'm sorry for that.
Oh, it's okay. But I mean, I just wanted to confirm that I'm hearing also Valerie and Andre comments, and they're absolutely pertinent. I think there are ongoing discussions. Colleagues from the country team that has been very, very strongly engaged. So they are looking into those options, including discussions at the global level for the occupied territories. I think what we learned over the past years, there have been also a few other emergencies, including Afghanistan, is actually that the Global Fund has been developing also internal some sort of a mechanism to respond quickly by engaging in senior management. We have a so-called crisis management team, and Peterson was very much involved. So you have the ability to have a very quick decisions and mobilize all the internal efforts in a very quick time, because we know, I mean, speed is very relevant for those situations. Everybody was actually appreciating the fact that we were able to respond in 24 hours. We were able to respond in a week time. This is very special and unique for the Global Fund, and we understood that is the secret for those situations. So we have formalized this approach, and that is going to be staying with us for, hoping not for other emergency, but that is a part of the experience that we learn. Thank you.
Thank you very much, and thank you very much to all the speakers. And now I give the word to Peter.
Yes, thanks, and sorry for timekeeping. 1 minute is 1 minute in Germany, and not 1.5 minutes. So.
Exactly.
And I hope you appreciate our humor. So with this words, we would go over to Lady Ross, co-chair of the Global Fund. So Lady Ross, over to you. What are your conclusions when you hear these stories? And thanks so much for being with us. Over to you.
And I'd first like to thank Action Against AIDS, Deutsche AIDS-Hilfe and AIDS Action Europe for organizing this important discussion. Thank you, Oksana and Peter, for the great moderation, and thank you to those participating in the G8 fan meeting online for joining us. I'd also like to thank you, Valeria and Andre, for your testimonies. Great to meet you, Valeria, online. And always fabulous to see Andre. Thanks to Oksana, the whole Global Fund now knows how to pronounce your name properly, Andre. You should have educated us earlier. Only through your words and experience can we get a glimpse of the tough reality your country's facing and understand how we can best support the communities we serve during the conflict. We cannot thank you enough for sharing your stories. It's no secret that to end HIV, TB, and malaria and address emerging health threats, we need to reach the most vulnerable in the most difficult situations. New disease outbreaks, natural disasters, armed conflict, mass displacement, all require us to be fast, flexible, and to put people at the center. It's in such moments that we see the strength of the Global Fund partnership. Only with the support of our donors and by relying on our close partners on the ground, like Valeria and Andre, can we deliver the needed services and medicines in a flexible manner to make sure no one is left behind. Andre and Valeria's testimony speak to the courage and resilience of the Ukrainian people, particularly of the HIV and TB communities who are working tirelessly to make sure those in need of life-saving treatment can access it. They're also a great example of what our partnership is capable of in the most difficult times. Since its inception, the Global Fund has contributed to saving 44 million lives, with deaths caused by AIDS, TB, and malaria having been reduced by nearly half in the countries we support. We've witnessed the Global Fund's immediate support to countries as the COVID-19 pandemic hit, with the quick deployment of resources to help countries facing COVID, but also adapt HIV, TB, and malaria programs to mitigate the impact on the hard-fought gains of the last 20 years. As we know, the Global Fund has approved $4.3 billion to date to support countries during the pandemic. And Global Fund is now the primary channel for grant support to low and middle income countries for COVID-19 tests, treatments, including oxygen, PPE, and critical elements of health system strengthening. Today, we see the Global Fund's swift reaction to the conflict in Ukraine. We see how mechanisms like the Emergency Fund can fulfill their mission and allow us to react immediately to help save lives. As Francesco pointed out, the Global Fund is supporting many other countries facing unimaginable challenges. In fact, a third of our total resources are invested in challenging operating environments. With pandemics, conflicts, and more extreme weather events, volatility and shocks are becoming the norm. Climate change will affect the epidemiology of HIV, TB, and malaria, result in more displacement of people, increased vulnerability, and risk of zoonotic diseases. We must adapt our interventions, but we have demonstrated that we can respond swiftly, flexibly, and effectively to crises. Ongoing support will be critical to help countries navigate an increasingly crisis-driven world. Greater investments in health systems are critical to build greater resilience and be better prepared for future health threats and crises. Germany's leadership has been instrumental to the success of the Global Fund partnership and to the COVID-19 response. We deeply appreciate its strong signal of support toward the Global Fund's 7th replenishment. At this time of uncertainty and colliding crises, our partnership is critical to ensure we can end the pandemics of HIV, TB, and malaria, and reinforce our defenses against the next deadly pathogens that will inevitably emerge. We look forward to continue working with our partners on the ground and with our donors to make sure we can continue carrying out our mission to support the most in need in Ukraine and in all countries where we invest. And I'd just like to remind you in conclusion that we have a website, a web page on the Global Fund website on Ukraine, and it has a thematic report on our work in Ukraine to date. It features stories, and there's also a thematic report on Global Fund work in other challenging operating environments with case studies. So go to the GF website and look for the Ukraine page. Thank you very much, everyone.
So thank you so much, Lady Ross. Thank you so much, Francesco, Valeria, Oksana, Andre. I have to learn your name. I'm old, so it's not easy. We are having further discussions on that. Really, thanks so much for sharing your stories. For me, the key word was from a donor to a partner. The Global Fund became a partner. I think this is absolutely strong, and this is the right way to go forward. We will have a demonstration in front of the Chancellery tomorrow from 8 to 10. So whoever has feet to walk, come and join in. There will be a die-in. It will be recorded. It will be one of our stronger advocacy moments that we use for the replenishment. And with this words, I think we have to close. We are 3 minutes over. Sorry for that. The session is recorded. It will be made public soon. My colleague Melanie, she is pressing the recording button. And with these words, I say thank you to everyone and see you soon again. Bye-bye.
Thank you very much. And it was really lovely discussion. Have a nice day.
Yes.
Thank you.
Thank you.
This